The public health issue that I'm passionate about is mental health. And the reason is because a close friend of mine committed suicide early in the year. Now, mental health, I think, is such an important issue because it has wider impacts on family and friends, and it's very destructive. So I want to look at this carefully, looking at the interventions that I think will have the biggest impact at three levels. Firstly, at a government level, secondly, at a hospital and sort of community level, and thirdly, at an individual level. So looking at a governmental level, I think the biggest impact that can be had in this arena is in prevention. I think more money and more development needs to go into education programs that teach and foster healthy behaviors, because we know these are protective risk factors for good mental health. For example, I've been reading Matthew Walker's research on sleep. At one point in the book, he actually talks about how the same genes that are responsible for a lot of mental disorders are actually the same genes that control our sleep and our sleep rhythms. So he sort of inferred that a lot of people with mental disorders actually all have poor sleep. Now, secondly, I think at a government level, there needs to be more money into research, because we just don't know enough about mental illnesses. One thing that is concerning and is a current debate is the over-medicalization of mental health. It's clear, of course, that drugs work in certain cases, but in other cases, it's not that clear, and it could be the case that it's making the condition worse. Another area the government can impact in prevention is in raising importance of looking after your mental health. We know that we're in a current pandemic now, and before that we sort of had the obesity epidemic. We're still in it now. But what about the mental health epidemic? The latest report from the Australian Institute of Health and Welfare revealed that almost 1 in 2 Australians will suffer or go through a mental illness in their lifetime. That's a massive amount of people. So looking at mental health sort of at more of a hospital level now, I think the biggest impact that can be had is employing more technology. This is especially true, I think, for young people who carry the burden of mental health. They are the least likely to engage in traditional healthcare. And so we need to develop technological programs because that's what they're familiar with. For example, on a personal note, I utilized and I reached out to a counseling service via Zoom that was offered by my university. And I found it very helpful and very accessible, very easy to use. Another area for technology at sort of a community level is social media. We know this is a popular platform and we need to push out the message there. Now, another advantage of technology in this space is that you can access it privately and securely. For example, I read an interesting article which showed that there was an increase in the use of technology-based mental health services in Victoria during the peak of their lockdown. When you access these services through a phone, you're not broadcasting it to your friends and family, and so you can it's a bit more accessible. Now, looking at this issue of mental health at an individual level, I think the biggest impact that can be had here is just removing stigma in the way we talk and the way we act. For example, I think everyone should try and live a healthy lifestyle because we know that this is very protective of good mental health, so practicing good stress reduction strategies and things like this. And then I think among males, there's a tendency to put up an image and not be vulnerable. And I've experienced this firsthand. I alluded earlier to my friend who committed suicide, and one of the laments that the parents constantly kept coming back to is, why didn't he speak up if he had a mental health issue? Why didn't he talk to his friends? Why didn't he open up? And so I think among men we need to speak up more and not be afraid to talk about our issues. At the same time, I think we have an individual responsibility among ourselves to watch out for each other, the people around us. We can notice when things are going south. And we can intervene early. Just asking how you're going, just having a chat, and being able to connect them to professional services at an earlier stage is quite necessary. I think the last point I just want to bring up is when we're feeling a little bit funny physically, maybe a bad back, we immediately reach out to a GP and go see professional help. The question is, how come we don't do the same for mental illness when we're feeling a lot more anxious or a lot more worried or a lot more depressed? And so we need to remove this stigma, and I think that starts at an individual level.